Hi, this is Greg McIntyre, the Elder Law Guy at McIntyre Elder Law, helping seniors protect their assets and legacies. And I'm very proud to be here with Kendalyn Lutz-Craver from Cornerstone Dentistry in Shelby, North Carolina. And there's a huge need in the community for seniors for dental care, for proper dental care. There's a hole in our system through the Medicare and Medicaid system to pay for proper dental care for seniors. And many times seniors will put off care or not receive proper care when they actually need it. There's certainly ties and proof, I think, she's the expert, not me, between longevity and dental care. So it's an issue that's really germane to seniors. It's certainly something that needs to be addressed. And Kendalyn and I, through meeting and talking, having lunch and trying to figure out, work on some of these issues, have given it some discussion and some thought. And I wanted to bring those thoughts to you today. So Kendalyn, thank you so much for being on the Elder Law Report today. Okay.
Well, thanks so much for having me.
Absolutely.
Absolutely.
Good to see you. Good to see
too.
you. So Cornerstone Dental Associates, is that correct?
Yes.
Is that the full name?
Full name.
Okay. That's a pretty amazing facility you have over
Well,
there.
thank you. It is. We're very proud of it. We've been in there 6 years now, but it's the first green building in the county, and we really were thoughtful about the process, wanting to take something that's not fun for anyone in dentistry and just make it a more comfortable environment, an environment where you're excited to come get care and you just feel like you're part of our family.
Okay. And it's the first green building in the county. Does that mean it's painted green?
It is not. Though I did have a few elderly patients who did question me as to why I was going to paint the building green.
Yeah. Why are you painting? Yeah,
Exactly.
Yeah.
That's not.
Okay.
It means it is LEED certified. LEED is Leadership in Energy and Environmental Design. And so it's a point system. You work with the architect, you work with the contractor, and you achieve different points to get your certification. We recycled about 70% of all construction waste. Every employee is guaranteed a daylight view. We do things that reduce the chemicals that come off of the paints and the furniture. The fresh air is coming in so many exchanges per minute. So you just do a series of things to make it a positive work environment. And a lot of research has shown with green buildings, you produce healthier employees as well. Less sick days.
Okay, cool.
Yeah.
Awesome. And just a beautiful building over there. We'll send out a graphic of what that building looks like. So what made you want to be a dentist?
I am, I guess, in the small percentage that always loved going to the dentist. So it was always fun for me. I had great dentists growing up.
You have great teeth.
Well, thank you.
Yes. I like teeth too.
You have great
There you
teeth too.
Yeah.
Teeth are,
So it's important.
teeth are very important.
They are
Extremely
very
important. And if you ask people what they notice when they meet someone, eyes and teeth seem to be the two that come up.
Sure.
And it changes the demeanor of someone if they don't have confidence in their teeth. You see it tremendously.
It boosts your confidence, and
Yes.
and people shouldn't judge you by your appearance, but many times they do, and even subconsciously, just it becomes an issue.
It does. It really does.
So you always enjoy going to the dentist.
Always. And then as I grew older and figured out what do I like in school, what do I enjoy, I loved math, I loved science, and then thought about what my goals are into adulthood, and that I kind of loved the idea of having a career where I could be my own boss and then use the math and science that I like, but also have some flexibility of schedule. I wasn't interested in being on call in the middle of the night or anything like that.
Sure.
So
you didn't want to be, say, an emergency room doctor?
No, not at all, because it was important to me to have a work-life balance, to be able to be a mom as well as a dentist. So just really, all of my interests that funneled in. Toward the end of high school, started visiting some dental practices, meeting with dentists. They seemed happy, and that was important.
Yeah, I mean, okay, so they had a good work-life balance.
And then, like I said, I loved chemistry. That was my college major, and you have to have 16 hours of chemistry to apply to dental school, so that just fit right in.
So it sounds like you knew early on, especially if you're visiting around in high school, visiting dentists. So that's really cool that you had that direction. Very few people have that yet.
Sort of my personality.
And speaking of work-life balance and being a mom as well, you have three
children. I have 2 boys and a girl. My boys are 7 and 9, 2nd and 4th grade at Jefferson Elementary here in town. And then my daughter Avalie is 3.
Okay.
So she does a little mother's morning out.
So, one of the things, I'll tell you how this came to my attention or mind. Because, a couple of years ago, I would have never thought that, dental care in seniors, that's a good mix or there's a need. But there is. And through being on some different boards that are catered to seniors or senior needs, boards of organizations that really think about senior needs and have professionals that, cater to senior needs, that always became a question is, how do we get proper dental care for seniors in the community? Is it something we can get all the dentists together that we can work on, something through the health department we can work on? And that problem or that riddle still has not been solved yet, okay? But you and I have started a conversation, and that's how I wanted it to start. It's just how can we solve that problem? What can we do? And I think you've already thought of that ahead of me and really already have some things in place in your practice to help seniors who may not have dental insurance or some type of program, say a benefit program that helps them pay for dental insurance. So what do you do when you see a senior?
What we do is we start every patient with what we call an initial exam. And it's a long appointment. You're going to hang out with me and my assistant for an hour and a half. We're going to take any needed x-rays. We're going to take photos. We're just going to talk about the goals you have and figure out what needs you have, how's the best way to tackle them, and how do we make them affordable for you. And so a lot of patients are surprised when they call our office and they think, well, I just need to come in and get a cleaning. But what people don't realize is there's different types of cleanings based on your needs. And it's crazy to jump in before we know what's going on. And I love that chance. That's a good chance for me to get to know the patient, for the patient to start to get to know me, and build a good relationship. I want patients that are comfortable asking questions anytime.
Okay.
And so we start there. Sadly, dental insurance is not like health insurance.
Right.
And so, more than anything, just like you said, we think of it as a benefit. And in this day and time, it's a benefit some people get with employment. I don't know if there's anymore that get dental benefits after they retire.
In retirement, right.
So, we offer lots of payment plans, lots of ways to make it affordable. And then, too, we try to work with our patients once they hit the age of about 50, 55, until 65, or whatever the retirement horizon is, to get their mouth ready for retirement, ready for the time when hopefully they just need maintenance.
So that's kind of like I do with people with pre-planning. We sit down
pre-planning.
and we pre-plan. We say, okay, you're going into retirement. Let's plan to protect your hard-earned money and property.
Exactly.
So that it's long through your retirement, right? And it lives with you the rest of your life.
Exactly. So if you have big fillings and we need to transition them to crowns, well, if we're looking at what can we do over the next 5 years, over the next 10 years, we take something that if we did it all at once would be overwhelming and extremely expensive, and we break it down. We do a little bit at a time and just step you along. We also work on...
because seniors, many are on a fixed income.
Yes. Oh, and that's overwhelming for so many. So I think the biggest message to get out to patients first and foremost is just because you don't have dental insurance doesn't mean that dentistry is not available, that it's so far out of reach. That sometimes we have a tendency to equate, well, I don't have dental insurance, well, if I didn't have health insurance and I had to go and have a surgery, I would bankrupt.
Right.
Dentistry doesn't have that same cost.
No.
Now, it is an investment. It's not, cheap by any means, but it is not prohibitive if you don't have dental insurance.
Okay. So, no dental insurance, that's a misconception.
It is.
You can still afford it.
Yes,
and you can
and
set
I would
up a
say
payment plan to afford it.
Half
And you
of
can
our
break
patient
up,
base,
what I hear is break up the entire care that's needed, so it's not a big income hit. Not having dental insurance is certainly not a bar to coming in and seeing you break up the payments, you break up the procedures so it's affordable for the senior,
Yes.
correct?
Yes, that's exactly what we do. So what we figure out first is what is everything you need. If it's just, 2 hygiene visits a year with the necessary diagnostic x-rays, We have some patients that pay that. They divide that up in 12 payments and just make a payment every month if they want a small payment. Others choose to prepay before their visit. If you prepay, you'll get a 5% discount.
Right.
And then some divide it over 3 months. So there's lots of different ways we do it.
Okay. So what about longevity? I've always, wondered if there's a connection between longevity and dental care. And I understand that there is. Is that right?
There definitely is.
Okay.
20 is our magic number. It's fun. At the office, we do a party every year. We celebrate all of our patients 80 years or older with 20 or more of their natural teeth. But what all the research shows is 20 teeth that function together. So 10 top and 10 bottom lined up.
Okay.
That is 20 or more, you're going to function well. It's going to improve longevity. Less than 20, then we see an increase in mortality rate. So definitely, as you begin to lose teeth and past that tipping point, your life expectancy decreases.
Okay.
So that's big.
So it's a great. You need to keep your natural teeth as long as possible. Right?
You do, as many as you can.
And good gum care. Gum care is that?
Gum care is huge, and a lot of people are becoming more familiar with that. But periodontal disease, it's an inflammatory process. It's caused by bacteria, so that leads to chronic, inflammation, bacterial issues, and so diabetes, cardiovascular disease. Some studies now are looking at dementia. It's all linked, and it makes sense. If we stop and think about it, sometimes we like to think about our mouth. It's just a completely different part of our body.
Sure.
But it's not. It's where everything starts.
Yeah.
And so it has a huge systemic impact. And so that comes into hygiene care. It is so important, to keep your gums healthy. The other thing we like to work with patients, I'm a huge proponent of electric toothbrushes, but especially as we get older, because if you think about a small toothbrush, you need good dexterity and you need a firm grip for a small, narrow toothbrush. But a nice, big base toothbrush, we love Sonicare. It does better than anything we can do.
I've never thought of that.
I love to get patients with an electric toothbrush. And also, do you remember growing up, when you went to the dentist, you always got a fluoride treatment? Well, why don't the elderly? Decay is a huge thing. If you're going to keep your teeth, and then so many are on medications, side effect of medication, dry mouth. Dry mouth leads to increased cavities. So everything just kind of cycles. So when you come, do a fluoride treatment with your hygiene visit. And then do fluoride rinses at home. And then, too, we like to look at diet. Sadly, we're a country of a lot of diabetics, of a lot of obesity. Sure. A lot of that comes from poor diet choices. So soft drinks, sports drinks, sugar or sugar-free. A lot of that is the acidic component. And then, too, once you get dry mouth, you want to keep your mouth wet. So we start grabbing candies to suck on.
Right.
So it's just thinking about all those things. Yeah. And so if you're gonna keep them, we got to get smart about how we keep them.
Sure. That is all great information. Would have never thought about some of those things. We even have bigger pens here because as you age, it becomes harder to deal with the smaller pens and things like that.
It does. Yeah. And if you the earlier you get in the habit, I think as people age, we all age differently, and we think about it differently, but as you get into the habits earlier, sometimes people are like, oh, I don't want to do that. I'm getting older. I got to get my reading glasses, or I have to get this or that. So we try to actually get patients involved with that earlier.
Right.
So it's just something that comes over time, so you don't have to have the conversation. Well, you are X age now. You don't have as good a dexterity anymore. Because sometimes those aren't.
You just don't brush your teeth as well.
No, you don't.
So you want to make
sure.
And
then, too, if you're used to that electric toothbrush, when you get to the point in time you have a caregiver, they can use that toothbrush in your mouth. Because the toothbrush does all the work for the most part. It's timed, it's vibration. They can use that same toothbrush, and even if they aren't a trained dental specialist, they can do a good job for you.
So dentists across the board can help cater to seniors more by thinking about these things, also by using a strategy and payment plans to perform preventative dental care or needed dental care for the senior, even if they don't have dental insurance and are on a fixed income.
Exactly.
Right?
Exactly.
Okay. And use those types of strategies to cater and help the seniors keep their teeth as long as possible, live longer, which we all want to live longer and be healthy, right?
Yes, because you know, as you begin to lose teeth, you know, you're going to chew less efficiently. I think the statistic is someone with dentures, as that bone, because not only does your bone shrink, your jaw muscles begin to atrophy because you can't apply near the biting force onto a denture that you can your natural teeth.
Right.
So for me to chew a good steak, which everybody wants a good steak, it seems, if I ever give someone dentures, they're so excited to get that steak. They have to chew it 7 times more than I do because of that just the decreased force.
Right.
And so all of that adds up. You know, you don't have as many teeth. It's harder for you to chew. What do? You start eating more processed foods, which leads to other health issues, and everything just snowballs.
Goes downhill. Yeah.
It does. And I think that's a lot of the increased mortality as we get below 20 teeth. We just completely function differently.
Well, dentists certainly have just a great place in our society as far as our history, as far as a real change in healthcare and longevity for human beings, period. I mean, dental, you know, if you let a toothache go long enough, that's a heart issue. It's an infection, right?
Exactly.
So dental care is just extremely important to longevity and health. So I appreciate you being on the show today.
Well, thank you for having me.
Thank you. Let's eat some lunch.
Sounds good.
All right. Thank you. Okay.